Hi, good evening. I'm going to be talking to the medical director of Laurel Fertility Care tonight, Dr. Smikle, and we're going to talk about the new normal way of living, what that means for travel, fertility treatment, mental health, what you need to consider, what perhaps you don't, every single annoying thing that's coming up that might be consuming your mind. And he is amazing. I love chatting with him.
I'm Collin Smikle. I'm the medical director at Laurel Fertility Care in San Francisco. We have offices here in the Bay Area, but have been taking care of patients from all over the world. So thank you for allowing me the opportunity to kind of join and to have the conversation about a thing that many people are actually having a lot of stress and a lot of anxiety about. So hopefully we can provide some information for them.
And I said, if people have any questions, please feel free to ask as we go along.
Okay.
I guess one of the things that I'm finding difficult, and I'm sure that you have some insight into this from all the patients that you're seeing, but in terms of seeing people face to face now, what are the different sort of rules for fertility treatment and for masks and not wearing masks and testing and how that might affect a cycle?
Well, first, this addressing how it'll affect the cycle. I think we're being very cautious because, we as medical professionals are very concerned about transmissibility of the COVID virus. Even though many of us are vaccinated, there is still that possibility of, someone coming into the office that's not vaccinated and then actually having that pass along to our other patients through us as vectors. So speaking about each of those areas, first, it's usual unless someone was truly infected and was symptomatic for them to have any profound effect in terms of the eggs themselves. That's a question that many patients ask. If I get sick in the middle of my cycle, will this affect me? If you're symptomatic, then getting sick will definitely do that, whether it be a male patient or a female patient. But if you're not symptomatic, then basically it's not going to affect the eggs themselves. The virus does not seem to affect either eggs or sperm. So that's one good thing for patients to know. However, if you're symptomatic, then having a high fever, having viremia, all those things are going to be concerning. So that may be one thing where your cycle may be canceled, and then patients are made aware of that. As far as the things that we do, fortunately, depending on some areas where we are in the country, the local levels of infectivity with COVID is actually diminished. And so masks are not as often used, say here in California, when you're outside. When you're in a medical facility, most of us are still making our staff wear masks, and also even though we're all vaccinated, and that's the primary thing in most clinics as well, because we want to actually reduce any kind of transmissibility. And then patients are asked to wear masks even if they're vaccinated within the clinic themselves. We've liberalized because and follow the guidelines of the local facility that patients who are vaccinated and their partners, if they're vaccinated, they may actually come into the clinic for some visits. And I realize that that's a change from when the pandemic first started, because we realized that, that's their level of social support. And not having their partners here has been a significant strain on couples, and also having the other partner feel like they're not part of the process as it goes through. And I think that's significant. They're not coming to all the events because we still are trying to reduce the number of patients coming through into the clinic at each time, but at some structured visits, they are being able to participate. They're always able to participate virtually, so therefore that's one thing that we still encourage. But it's allowing us to move back into a post-pandemic means of caring for patients, and you might actually say moving into the tier of the vaccinated versus the unvaccinated as another tier. And I realize that that brings up a lot of either questions or concerns patients may have because of their belief or, their autonomy in terms of vaccination versus not vaccination. So that's primarily the way that we're addressing it here. A lot of people are still very stressed because this is a stressful process to begin with. Layering on the pandemic and the social distancing that was required has impacted quite a few patients. Fortunately, it doesn't seem to have impacted pregnancy rates or any other means for management of their care. So therefore, that's been fortunate, but patients still have a lot of concerns about that.
And for patients, this is something that readers have asked me before. I'm sure you get this a lot, but if they have recently had COVID and they're about to go into a treatment cycle, what's normally your advice with your patients in terms of the body's kind of the state of the body at that stage?
I think that is something that we're going to continue to reassess because we do know that there are individuals who have long-term effects of COVID, even someone who may not have long-term effects but have some effects from COVID and a vaccination that we don't know if they were symptomatic before. Those who basically had mild disease, it's not likely that they'll have any impact. If they've had significant disease where they may not have had to be hospitalized, but if they were ill for periods of time and they're recovering, although they may have passed through the phase where they're now either symptomatic or they may end up having active disease, one thing that we know is just that they may end up having some sort of effect where we're reassessing their function, whether it be looking at sperm afterwards or looking at egg or ovarian function or ovarian reserve. There is concern that the patients may actually need to be stimulated more aggressively if they're actually borderline reserve. So those are the things that we are questioning about. Those are the questions that we're raising now. I think they're not really known because there's nothing that's been written or established, but that's a concern many patients have about needing to take more medicines, and providers have in terms of needing to stimulate more aggressively to achieve that same goal we started before. So that's actually something that is a very common question, and something that we look at in persons with previously active disease. Someone who basically was just exposed and never sick, then I don't think there's any risk or concern from that person having any care function. So that's important.
I'm not sure where things are in terms of the vaccine rollout in California, but do you still have some patients who haven't had both doses yet?
Fewer. I'd say in the Bay Area, the majority of our patients have now who are wanting to be vaccinated are now fully vaccinated. So therefore, it's not likely they'll actually have only a single dose. So We're seeing less of those individuals who are unvaccinated. There are still going to be holdouts who are not vaccinated at all. And fortunately, at least until recently, the number of people in San Francisco proper who were vaccinated was greater than 70%. So the rate of actual active disease was very low. Given the prevalence of the new and stronger variants that are actually coming about, we're seeing numbers drift up. So we're having more infections. The unfortunate thing is just that, as anywhere else, most of those new infections are with the unvaccinated group. So that's a concern we have in terms of basically making sure that we're maintaining our caution in terms of trying to make sure that we're not going to expose individuals to disease. Meaning that although all our staff are vaccinated and we're reducing any kind of risk for transmission, we don't want to be vectors to someone coming in and having a new variant, because that's the individual who got sick to kind of pay attention to.
Definitely. And are there any considerations for people who might not be vaccinated or who don't want to have the vaccine when they're having fertility treatment?
I'd say that no, there's going to be a low risk for them to be exposed within these environments. As I said, because the risk of the number of individuals in the area that are actually vaccinated now, although we haven't gotten to the point where we have true herd immunity, there's one where you actually have lower transmissibility because there are just fewer patients with exposure or disease. I think the thing that we're going to be looking into in the future, just like anywhere else, is just that now that people are traveling more, they're going to bring back disease to the area. And then that's something we're going to have to continue to attention to and to address as it comes up. So it's not something that we can simply just say we're going to go back to normal and that's going to be life as it is. I think we're going to still be in this holding pattern for a bit longer.
It's great to hear that you're able to allow partners back into scans and things like that, because I don't know if you were finding, but did that have a sort of negative impact on people's mental well-being when they were going through treatment?
God. Yes. Like anything, first, going through the fertility process is a stressful endeavor to begin with. Not having support staff for your retrievals, transfers, coming in for new patient visits, that's the stressful part where you're the person who's going to end up being, providing all the information. And although we're still allowing patients to, having phone consults or, participating by teleconference during their partner's, exams, it's not quite the same. Patients want access to their partner right there. And it was stressful, especially when in a situation we're not always successful, or when patients are going through retrievals or transfers because they wanted someone there. Fortunately, it didn't impact our pregnancy rates, but it definitely impacted the stress levels within our patients.
Mm-hmm. My husband wasn't there for any of my retrievals or transfers, and that was due to having had the microplasty operation and recovering in a hotel room, the work schedules being, between America and London. And I found that this was pre-COVID, but I found that really quite lonely going through parts of the process on my own, and lying in the bed after a transfer or retrieval and just sort of FaceTiming him, or just trying to keep my mind from not going crazy and not worrying about every little thing that I worried about, which I'm sure people watching can definitely relate to. And what do you see happening? I mean, you don't have a crystal ball, but what do you think the future looks like in the next sort of 6 to 12 months for fertility treatment and during this time?
There are a number of things that, if I had a crystal ball, I might actually say are ones that we're seeing trends. First, I do think that we're not going to go back to the way things were before. So therefore, we will continue to have telehealth visits. We will still probably be wearing masks within the clinic for some time for the foreseeable future. I do think that, as more patients get vaccinated, it'll allow us to, at least as we follow the trends from the CDC and other environments, be able to have patients participate. I don't think we're going to end up having a situation where you're going to end up having the volume of patients coming into the clinic as we did before. So as with other places, what we're doing is we're expanding our footprints to providing more locations for patients to be seen, just so we can kind of reduce our footprint with each patient having to either wait or having to prolong treatment. So those are things many practices are doing now. I think the challenge is going to be those that aren't able to do that, how patients will actually manage that part of it, because it will cause some delay and patients may get frustrated. Older patients who don't have the ability to wait may end up saying, well, we'd have to look at other alternatives. So those are the things to kind of look at.
Are you finding that patients are starting to feel a bit more comfortable about traveling? Are you seeing patients coming in from other areas of the States or from abroad yet?
Coming in from abroad, I think it's going to be harder only because the travel restrictions that the United States have are not really, we're not controlling it here locally.
Yeah.
So we don't see the same amount of patients that we did before, far less than we did before. In
Mhm.
time, that may change. So therefore, we do have telehealth visits from patients from all over the world. And so as they feel comfortable coming in, then that may actually change. I think the challenge is just that, those who are vaccinated may end up having an easier time traveling. Those who are not vaccinated are going to end up having to be concerned about the quarantine period that they have to undergo either here or there. I know that we've seen patients who are from, say, Asia, who their restrictions when going back home are pretty significant. So therefore, they're just not going to come because they can't afford to then quarantine for 2 weeks after they get back. So that's another part of it. So therefore, that will be with us for a while. And so I think, that'll kind of restrict some of the foreign travelers coming into the area. As far as local clients traveling or patients traveling, patients have been piped up for a year. And I'm pretty sure that you feel that same effect where you want to actually see other places as well. I know I do.
Yeah.
And, I feel like it's just really a wait. Do I feel comfortable traveling now? I'd probably still wait a little bit longer to, especially given the new trends in terms of the spikes we're seeing in the new variants. But hopefully we'll be able to travel soon, and others will as well.
Hmm. Yeah, absolutely. I was just saying at the beginning of this, actually, I'm going to Spain for the first time in a long time this coming weekend for a couple of days. And I was quite overwhelmed with how much I needed to prepare to be able to
Hmm.
go in terms of testing and documentation. But once I got my head around it, it was actually okay. But I think what's been a little bit tricky, I don't know about in California, but in the UK, is that countries keep going on to different lists. And so
Yep.
the rules keep changing. Our Prime Minister keeps changing what what that means in terms of testing and quarantining, etc. So it's just another level of stress, isn't it? And as you said, fertility treatment is so stressful anyway. It's very difficult, and I empathize with anyone who's having to go through treatment during this era because it's just another level of stress that you don't need. But do you see a light? Do you feel like things will get better?
I think as patients get vaccinated, that light will actually shine a lot brighter. I I'm a little bit pessimistic of the unvaccinated because I think they're going to end up having more restrictions placed on their ability to do a lot. They'll always have access to care and they'll always have access to emergent care. I think it'll be more restrictive in terms of their partners being able to come into clinics and their what they're going to have to go through. Not because of the risks that are there, it's just that no one wants to go back to that area before where we're either, increasing contamination for the staff or contamination for others within the clinic. And
Mm-hmm.
so those individuals are going to end up having more testing and having to undergo a lot more scrutiny. For those individuals that we are requiring them to do COVID testing, whereas if you have proof of vaccination, then you're not. So therefore, that's another, um, you know, um, divergence that you'll see. And that's at least the conversation that's being considered now, in areas throughout the United States. I'm not sure if it is the same in Europe, but that's something that, we'll have to contend with as well.
Mm-hmm. And are you seeing a change in your patients in terms of their morale? Do you feel like people are starting to get used to is probably the wrong word, but COVID, we've been living with COVID for,
Mhm.
you know, nearly 2 years now, haven't we? So 18 months to 2 years. Um,
Mhm.
you know, do you see a change in mindset? How are your patients?
I think patients are actually finding other measures to boost their own sense of um, self and isolation. So I think I've seen patients develop new habits, if you will. So maybe that's a different way of looking at it. Because they're feeling that they've actually weathered a lot. Those who've managed to get come to the other side feel more enthusiastic or feel more encouraged because they feel like now they're seeing a brighter side of everything. And I'm not saying that they're not stressed, because I do think that, it's still untold how much stress people underwent during this time period and how they're managing that part of it. And I do think that we try to be empathetic to patients' stress when they're going through, and probably a lot more forgiving than we were before. So therefore, it's taught us to be empathetic for individuals as well. But I think that's going to be the important part for the next step in terms of, how do you manage those things? And again, it comes down to trying to be as open and honest as possible in terms of educating people about what to expect, where to be. And so, that's what we see in the future.
Mm-hmm. If anyone has any questions for Dr. Smikle as we chat, please do ask. I know that it can be, or is a very anxious topic and time. What about patients who have had a successful round of treatment? Are you seeing apprehensions in early pregnancy as well?
I'd say no. I'd say that's actually been the greatest benefit, if you will. I think that that initial anxiety after everyone was first quarantined, that's when you saw a lot of anxiety about getting pregnant with the disease. If you recall, when Zika virus was first evaluated and talked about, people were really scared, and they were talking about terminating pregnancies because of that fear of Zika. I'd say that, because, getting pregnant is a way that many people have been looking forward to for a long period of time. There's a greater degree of buoyancy in their attitudes, in their outlook, and it seems almost cathartic in terms of when they've gotten pregnant and been successful.
Mm-hmm.
So I think that's actually what we see more than, someone who's feeling, apprehensive. I'd say if I'd had this conversation a year ago, the conversation may have been very different, because I do think there are people who are more apprehensive then. They're not so at the same time now.
Mm-hmm, absolutely. And what about for patients where a cycle or treatment may not have worked? Do you see people questioning whether it's to do with surroundings and what's
hmm
happening?
I think the thing that we see is just that in patients who had an adverse outcome, the first thing that they questioned is that, well, I felt a little bit ill over that period of time. Could it have been related to that? And so for those individuals, what we've actually talked about is first waiting until all those symptoms abate, waiting until after you're vaccinated and you're fully covered, not going to have that same. Try to go through measures that'll be helpful. I don't think that it'll be anything that you can actually. Patients have.
Mm-hmm. Yeah. We talked obviously a little bit about apprehensions and feelings around treatment, but one of the biggest things that I've seen in the community is kind of mixture of feelings between looking forward to seeing people more and the world opening again, and then also at the same time feeling kind of a bit overwhelmed at the prospect of things going back to how they were, because as for people who are going through infertility and fertility treatments, it can be sometimes a bit too much to be seeing friends
Mhm.
and family all the time and being asked questions all the time. And sometimes you can disappear from that a bit if you're at home in your, excuse the pun, but in your bubble. But then part of you or part of people also, want to see people again, because you can have that face-to-face contact for support and reassurance
Mhm.
and care.
Well, one that brings up one aspect of it, if you will, in terms of the one thing that we did see to the latter part of this, I'll call it sequestration, where patients are staying at home, is a lot more patients had access to care that they might have actually delayed before. And what I mean by that is just that those who had the time, because they were forced to, could now focus on their fertility treatment. And so they didn't have to worry as much about having to go into the office, having to worry about those who were working from home, had a means to kind of structure their time a bit more, and they fit fertility care into that a lot more effectively. I think those patients felt more encouraged by the process. As you know, and the thing you alluded to was just that, fertility treatment can actually be very stressful because you don't want to share with individuals. And because you were, cloistered, you didn't have to share. You shared only with your close, intimate friends who were in your bubble. And so patients felt more encouraged. A lot more people enlarged their bubble, so they talked about it more. So you had people coming into fertility care because their friends who talked about it before encouraged them to do that part of it. So I think it was more helpful for some individuals. And going back to what you were asking before in terms of some of the things that you see, is just that as we start liberalizing that net and actually expanding more, we may end up going back to that part where people are going to feel more isolated and not coming in as quickly as we did before. And so it's going to be situations like these that encourage patients to kind of go through and seek care that'll be helpful in terms of guiding people to access things when they need to.
Mm-hmm. Yeah, no, that's really good advice. At Laurel Fertility Care, you do a lot of holistic support for your patients, don't you, in terms of
Mm-hmm.
mental well-being? Can you tell people a little bit more about that?
Well, I think the biggest part that we try to focus on is just the fact that, the process itself can be pretty stressful. Although, we as providers may be empathetic to the process and empathetic to individuals going through, we're not really healthcare and mental health professionals. We can provide some resources, and we can provide, access to much more qualified individuals who can help them through the process. And I think, people have now, left themselves open to being more directive and more in tune to looking for care. And so we've expanded our list of providers who, we've actually referred patients to, because, that's been really helpful in terms of getting patients to, the level of care they need in a more quick, in a much more rapid fashion. And that's been helpful. That's been really, really helpful.
Mm-hmm. Yeah. And just to finish with, any advice for people this summer in terms of carrying on with life and enjoying themselves whilst going through treatment?
I think, that's a great way of closing, and actually a great way of looking at it. I think the biggest advice would be to really try to focus on self-care. And I think, it's something that probably kind of took for granted. And also when we described it, it was much more one where there was not as much either attention or as much true emphasis on basically mental health well-being. And I think the most important thing we realized over the last 18 months is just that stress can have profound effects in so many different ways. And, it affects us, when we're caring for others, when we're caring for ourselves, when we're caring for, our families. And so if you're not really focusing on that at all times, it's not just your overall well-being that'll be affected, it'll affect everyone around you. So I think the biggest thing and the biggest advice is, try to do whatever you can, whether it be exercise more, whether it be, basically, expanding your circle of friends and providing care just so that you can feel comforted through the process. I think the most important thing that I've gotten out of this is I've identified my true friends, because I think, those are the people you want to be around. Those are the people you're going to be, stuck with, if you will. And so finding those people is going to be really helpful. And if you're having some sense where that's a challenge, then making efforts to do that is going to be the more critical thing to do as well. And that's going to be an important thing, a lesson to learn for all of us.
I think you've just raised a really good point, and that's something that I've learned through COVID. I know I haven't been going through treatment right now, but I've really started to care about who I spend time with.
Mm-hmm.
So I've realized, and this might sound like a cliche, but life is short. And so I really want to be spending time with the people that mean a lot in my life. Whereas before, I think I was, seeing all sorts of people who I felt I needed to see. And I think you just, as with fertility treatment, you just start to know who your proper true friends are. And I think you can be, if you want to be selfish with your time and do what works for you, then so be it, right?
I do think being selfish is the important part, not selfless. I think selfish is going to be, and you shouldn't actually basically be selfish to the point of, impacting someone else's well-being, but being caring for yourself is important, and I
Yeah,
think that's the thing to focus on.
absolutely. Doing what makes you happy and what's gonna, yeah, make a difference to you. Yeah,
Right.
definitely. Well, thank you so much to everyone who's joined. Thank you for your time, Dr. Schmeichel. It's always such a pleasure speaking with you. And we'll speak to you soon.
All right. Thank you again for the invitation, and thanks for all of us who listened in, and hopefully everyone benefited. Okay.
Yeah,
All
absolutely.
right.
Thanks, everyone.
Take care now.
Bye.
All right.
Bye.